Hi, good afternoon. This is your Rockland County Executive Ed Day. I want to thank you for joining us today as we give you our weekly update on COVID-19 and other issues of importance to our Rocklanders here. It's been a very busy day. Major announcement by the state. The governor announced the expansion of a number of areas. 21 areas in total across the state have been identified, have clusters, and they're now being identified as having zones. Most of the areas are yellow zone, which is the least intrusive. Some are more than that. Rockland is one of them, but I want to be clear that this is just not a Rockland issue. This is an issue that's statewide that the governor has taken action on, ostensibly, obviously, because the numbers have been peaking in pretty much across the entire state and the nation at this point. Rockland's yellow zone includes areas such as Pearl River, Suffern, Haverstraw, and Stony Point, and New City. We have a map here. I put this together real quick. It's not perfect. You can go to forwardny.gov. Remember correctly? forwardny.gov. John's going to put the a link on the comment section at the end of the broadcast. And also you can go to rocklandgov.com. I believe we have that up on our dashboard already. So we're in good shape. So basically, this is the map right now. John, am I looking all right?
Yeah, a little closer.
Okay.
Yeah.
Okay. Basically, as you can see, roughly, the town of Ramapo, North Rockland, Stony Point, and Haverstraw have pretty much fully engaged in being part of the yellow zone at this point. Clarkstown, the area of New City, which is number 3 in infections at this point, has a significant portion, while the rest of Clarkstown seemed to be spared from this. And Orangetown has part of this yellow zone towards the southern part of the map. So again, you can see this as a high-res map later on when you get a chance, but that's basically how it plays out right now. Now, again, as I said, the yellow zone restrictions are the least impactful of all three, red, orange, and yellow. It predominantly will affect our young people who are going to school, because there are testing requirements for schools, 20% staff and children every week. So that's a significant interruption for these young people in particular. Houses of worship are to be held at 50% of maximum capacity. Dining, indoor and outdoor dining is still permitted. They're looking at a minimum, a max of 4 people per table. So basically, if you're going with 8 people, just put a space between the 2 tables and you're in good shape. Restaurants still have to close at 10 p.m. That is something that I do not agree with, and I've made that very clear. But it's 10 o'clock they have to close for on-premise consumption. Schools, as I said, 20% weekly testing of students and staff. The school districts will work this out, and North Rockland, I believe, is now virtual, so they are unaffected by this. I know that Clarkstown had put something out already. I already saw a copy of a message from Dr. Cox. So they have to figure out how they're going to do this in conjunction with the Department of Health, which will supply assistance as necessary. As I said earlier, we're going to post a link to the restrictions also in the comments section, because these are changing very rapidly. We want everybody to understand what they're up against and what it means. I think, frankly, we should look at the governor's announcement as a warning, and that's how it should be viewed. We must redouble our efforts to take the proper hygienic precautions. I was interviewed today by News 12, and I made it very clear, and I've said it to you many, many times. We don't know exactly what we are up against with this virus. There's no other way of putting it. The experts are not experts all the time. We certainly understand how this can impact people at times. It can range from a mild cough, a slight fever, to fatality, and it's something that's vexing to even the experts. So again, the only tool we have in our toolbox to slow the spread down is proper hygiene, keeping away from other people, social distancing, covering your face, use a face mask, wash your hands regularly, and again, avoid, if you touch things, touching your face, especially your eyes. Those are the basic things that that's not a vaccine. That's common sense right now. It's all we have. So I would just tell people right now, please redouble your efforts to be safe and to keep others around you safe. Because remember, it's not just you who may contract the virus, but your loved ones could also. So it's due for everybody. we're concerned, obviously, with the increasing case numbers here in Rockland. There's no getting around it. We can't just ignore that. We use our contact tracing program to try to get a handle on what exactly are the drivers here. And what we've come up with is the main drivers we are seeing right now in this virus point to youth sports, especially travel sports, parties, and family events, family gatherings. These seem to be the main drivers of the COVID virus. But taking these precautions now, particularly within the areas that are now expanded to yellow zones, we can avoid further increases to local restrictions. And I'm going to bring something else up here. The data gathered by the Department of Health does not point to the need for any additional restrictions on our local business. And I certainly support that notion, which would be put in if the numbers continue to increase. We have very vocal discussions every day with the governor's staff. This is a bone of contention between the county executives in the Mid-Hudson region and other regions and Albany. The data does not support closing businesses. It just doesn't. Some people have made commentary about the coronavirus as being the Cinderella bug. At 10:01 as opposed to midnight, it somehow gets worse. It's utter nonsense. It's not true. If you practice smart logistics in your stores and your locations, you're not going to have no more risk at any other time. And we've made that clear. We don't want to see that happen. But the precautions put in place in restaurants, in gyms, retail shops, and other businesses are working. And working together to limit the further spread, we can and protect our entire Rockland community. I'll give you an example. Gyms were closed at 10 o'clock along with restaurants. The logic beyond us. All I do know is gymnasiums were getting about 1.5% of all the complaints here in Rockland County, which I did bring up to Albany. I also brought up the fact that we have a couple of gyms, I believe, are 24/7. We have our first responders who go do 4 to 12s, whether it be nurses, firefighters, cops, and go to the gym to work out afterwards. They were going to the gym at 12 o'clock at night, 1 o'clock in the morning. By shutting the gyms down at 10, you're now forcing these people to exercise during the day before they go to work. You've just now increased the amount of people in the gym. It's not logical. And, we would love to see a little more input to these things before the directives come out. But certainly in this particular case, there is no question that there is a spread that's growing here right now, and it's going to fall to us because all the rules around, all the laws that are created, all the directives you're going to hear are not going to change one thing. It's within your power to be smart. That's what this comes down to. I know it's frustrating. I know people are fed up with masks. I get it. All right, but at the end of the day, you can't look at these numbers and just shirk them off. They are increasing. We stopped them once. We can stop them again, but that's going to be largely our choice. Right now, I would like to turn this over to my very patient communications director, John Lyon, who has been fielding your questions. John, let's go forward with that.
Absolutely. Thank you, and thank you to everyone who wrote in with your questions today. First things first, how are our numbers locally, particularly hospitalizations? How do they look?
Okay. At the end of the day yesterday, November 18th, we had 1,562 cases, 1,562 cases, which is relatively close to where we were, our previous peak of 1,649 back in early October. I did update on a graph here, and again, you're not going to be able to see a lot of it, but you're going to get the idea very quickly. Put this out here like this.
Yep.
We're good?
Yep.
Okay, on this side here, that's August 18th. That's where we were. It's 82 cases at that time. Over here, October 9th, that was our peak of 1,649. Over here now, we are now approaching at 1,562. You'll note that there was a downturn, and now we're going back up again. I got the right side? Yes. It was from October 9th, we started driving the numbers down. You'll remember that we had the red zone and the orange zone, and it was some focused efforts being done for enforcement and education. Those things were being addressed. So that was something that clearly helped the matters a bit. It's now going back up again in very short order, in less than a month. So again, it should serve as a clarion at this point that we need to take some additional steps. The cases are spread all over the county. This is no longer a 1 or 2 zip code area. This is the entire county as you can see by the yellow. Right now, when you look at the zip codes, the top 8, Spring Valley, Muncie, New City, Nanuet, Suffern, Stony Point, Pearl River, and Garnerville. Some of these areas had no cases a few weeks back. Now they have 80 cases. So things are changing, and they're not changing for the better. So we've seen an increase also in hospitalizations. Right now we're at 51 hospitalizations for people who are confirmed to have COVID, and they're in our local hospitals. It should be noted, however, even with this increase in hospitalizations, and they're being very concerning for those people who need treatment, the numbers are manageable, and they're well within the ability of our hospitals to handle. You'll recall that we were in the hundreds back in the dark days when this first came upon us in the spring. There are over 36% open bed capacity for hospitals and hospital beds, and 64% capacity for ICU beds. Now, I offer that as a counterbalance to the starkly increasing numbers here. I don't mean it to tell you, I mean to tell you so you're not overly concerned, but you still should be concerned that we need to drive these numbers down again.
Okay, and one additional point to add, there was just a question about precautions hospitals had put in place. Both of our local hospitals have shortened the number of visitor hours, the number of people who can visit, and have strict requirements for temperature taking, PPE, things along those lines when you do go to a hospital. But on to our next question. This person wrote in, at what point are schools told to go to remote instruction? How high does the infection rate have to go?
Okay, school districts make the decision to go remote instruction on their own. The only exception to that would be unless the governor issues an executive order that affects them. Towns, villages, county do not have any influence at all over the school districts. They are separate governmental entities. They answer to the New York State Department of Education, New York State Education Department, and that's the way that works. So they make their own judgments. As I said earlier, in Clarkstown, which is part of Clarkstown, will be affected with this yellow zone strategy, which would impact the schools. Judgments will be made by the Clarkstown School District as exactly how they're going to do this. Health Department stands ready to help, but at the end of the day, every decision made is done totally and completely within the school districts. Again, the 20% rule, I would urge you, when you're done seeing this, get the high-res map from the various links that we're going to provide for you. Take a look and see if your school is affected. If it's within a yellow zone, it will fall to that category of having 20% testing of the students and staff. And again, this testing is not the invasive testing with a swab being swabbed up your nostril. These are very, very lightweight type of tests. It's something that's not going to be uncomfortable in any way, shape, or form.
Okay. The next question that came in is, how legal are all of Governor Cuomo's executive orders?
Okay. Look, I have agreed with the governor, and I disagree with the governor, but the fact of the matter is, no matter how you feel, how I feel, the executive orders are legal. That is just a fact. That's under State Executive Law 24, and that we'll provide a link to that if the video is concluded so you can actually see that. But Executive Law 20, Section 24 gives fairly broad powers to chief executives in the event of public emergency. That includes power to establish a curfew, to regulate and close businesses and places of amusement within school zones, limit the sale of alcohol, designate emergency shelters, and to suspend local laws or regulations. I have used this authority 3 times. One during a very severe snowstorm some years back, where it was critically important that we got cars off the road for a period of 5 or 6 hours because we were getting hit with 3 inches an hour of snow. We did that. We implemented the emergency order at 10 o'clock in the morning. We rescinded it at 4 p.m. because obviously travel was not allowed until we rescinded it. And it gave our trucks, both all municipal DPWs, the chance to go out there and clear the roads for all of us. So those of you who went to work in the morning were able to get back home without having to deal with major snow. And the other times was the measles epidemic, which we successfully navigated through. And the current situation now, we have maintained an emergency order ever since it was first initiated by the governor. The powers are limited to orders which safeguard the health and welfare of the public. In answer to a question I've gotten many, many times, how do we stop the executive orders from being sent out? The only way that that can be stopped is for the state legislature to pass a resolution terminating a specific emergency order. This would need to be passed by both the Assembly and the Senate. So that's called the balance of power. So if you feel that these emergency orders are something that should not be happening anymore, that you feel that the emergency should be over, you speak to your local assembly person or your local state senator, and you express that to those representatives and let them understand how you feel.
Okay. And what good news is there that you can share with us today? I know there have been some good things in the news lately.
There has been good news. It's hard to tell the way we opened this program up today, but we have an update regarding the vaccine that Pfizer is developing. Yesterday morning, the company announced that their vaccine is now 95% effective against COVID-19, beginning 28 days after the first dose. And I say, recollect, you have to have 2 doses. The data is based upon the primary efficacy analysis they've done. They announced that this effect was consistent with age, gender, race, ethnicity, demographics. The reported efficacy in adults was for over 65 years of age was over 94%. I almost said 95 years of age. Getting ahead of myself. The preliminary data that we have demonstrates the vaccine will be tolerated by all populations among the 43,000 participants. There was no serious concerns observed, and I want to acknowledge those 43,000 people for stepping up to the plate and allowing themselves to be the proverbial guinea pigs in search of something that would save the rest of us from this virus. The adverse effects that have been seen, frankly, no greater than 2% in frequency, and the major ones have been fatigue and headache. Fatigue at 3.8% and headache at 2%. So they plan to submit within days to the FDA for emergency use authorization and share their data with other regulatory agencies around the globe. The companies expect to produce globally up to 50 million vaccine doses in 2020, this year, and up to 1.3 billion doses by the end of 2021. Again, I want to extend my thanks to the hardworking team at Pearl River's Pfizer site. They've done an amazing job in primary research and development center for this vaccine. The folks there are adding to the already proud history, 107 years worth of history at that site, where treatments for diphtheria and leukemia were developed, along with vaccines for smallpox, and one that many of us remember, I remember it, polio. You are making Rockland very proud. I want to again express my gratitude to Pfizer and for the team there, and for those who were part of this great effort to combat this COVID virus. We have to ask, what are some of the things? Oh yes, I couldn't forget, the Great American Smokeout is today. And I can tell you, as a former smoker myself, quitting is not easy. But I can tell you the health benefits far outweigh the difficulty. I can only tell you one of the smartest decisions I've made in my lifetime was to quit smoking. I started when I was a teenager. I quit on December 29th, 1994. I remember the date. It was not easy. As a matter of fact, the good Lord helped me out, because just coincidentally, then a couple of days after I started to quit smoking one more time, because we always try and we fail. I had some problems with my chest, and I figured it was just a reaction to not smoking for a couple of days. Turned out it was pneumonia. That was God's gift to me, because I can tell you, with pneumonia, you're not going to want to smoke a cigarette. That's like putting a knife in your chest. So it assisted a bit medically by pneumonia and resting up and taking it easy for a couple of weeks. I was able to quit. But the Rockland County Department of Health can help you quit smoking. There are many, many more tools available now than there were back in 1994. So if you or someone you love is ready to quit smoking, wants to make that effort, or you need information, they are here to help. Our DOH is among the finest in the state of New York. They have the skills and the experience to help you become smoke-free. So I would suggest to you this: give them a call. If you're thinking about it, do it now. They're still here. 364-2651, 364-2651 to quit smoking now. You can also call the New York State Smokers Quit Hotline at 1-866-NY-QUITS, and numerically that's 1-866-697-8255. 8487. And again, John will put that up in the comment section of the Facebook Live event when we close it out. Finally, we have Thanksgiving coming up. I know there have been a lot of jokes about 2020. There's been a lot of pain that's been part of 2020. All I can say to you is this. As terrible as things have been, we have many things around us that we should be thankful for. We have friends, we have family, we have so many good things around us, and I know it's hard to identify these sometimes and to try to focus on those things, but try to make an effort this Thanksgiving, and also try to make an effort to look around you. Look at those who live near you. Look at your friends. Some people who haven't had people come and visit them this time of year, especially with this COVID. There's a lot of loneliness out there. I will tell you, as a former member of law enforcement, I've seen a lot of pain in my lifetime, and I will tell you that it is this time of year, during the holidays, that pain is felt ever so more keenly in many people. We see upticks in suicide this time of year, and you'd be amazed at what a simple outreach can do, not just for the person you're reaching out to, but what it can do for you. It is a great feeling to be in a position to lend a helping hand to others. So in that spirit, I would ask you to enjoy the holidays, enjoy family, enjoy what you can, because our life on this earth, we never know how long we're going to be here, so it's best to enjoy what you can while you can. And with that, again, happy Thanksgiving to you and your family, and we'll be back. We will not be back next Thursday. Obviously, I'll be having my Thanksgiving dinner with my new family. So with that, have a wonderful evening, wonderful afternoon, and good luck. We'll see you soon.